If you've landed on this video, you probably are dealing with back pain, and you might even be dealing with knee pain or pain shooting down your legs. Did you know that probably one of the #1 causes of this pain is a bulging disc? Now, so many people are dealing with bulging discs. Why is that? Well, because one of the #1 activities that most people do every day for at least 8 hours, if not more, is sitting. So when we look at our back like this in a sitting posture, we're starting to press our discs out. And as those discs start to press out, they start to press into the nerves, the pain receptor nerves of the back, and then they start to stimulate those nerves that are going into the sciatic nerve and then down the leg. The good news is that we can begin to correct some of that. We can begin to correct some of the bulging disc issues. So I'm going to be doing a couple of videos, and I've done some before on my channel that you can go check out, to help dealing with bulging discs and start to correct that. One of the most important things to keep in mind that if you're dealing with bulging discs is not only do you have to do these corrective exercises almost daily, but you also need to do a program, a muscle activation program, to really begin to activate the muscles in the lower back so they can stabilize the joints of the vertebrae and create more stability. If the vertebrae is being supported properly, then you're not going to really deal anymore with those bulging disc issues. But because you're sitting all the time and your lower back is in flexion, it's that action that's going to keep pressing those discs out. So besides doing these exercises, remember that when you're sitting, sit up as erect and extended as possible in the proper way so that your spine is supported and all the discs will also stay in place. Okay, so what I'm going to do is just show you a few different exercises that you can do almost daily and see if you can start to include this into your program. One side note that a lot of people, when they go to bed, if they're dealing with these bulging discs issues, a lot of people sometimes can't sleep at night because of the pain that they feel. These exercises are really, really useful to do just before you go to bed, and they will help to start correct again some of these bulging disc issues so that way you can have a better night's sleep. All right, guys, so this is the very first exercise that we're going to do. I'm going to show you 2 easy hacks in this video. Now, as we mentioned before, that when our spine is constantly in flexion, it's pushing those discs out. What we want to start to do is get that curve back into the lower back, and by creating that curve, and then when we come out and start to stand back up, there's going to be a vacuum effect created inside the vertebrae, and it will start to pull that disc material back into the vertebrae and thus alleviating the pressure on the spine. So I've got Angela here, Angela helping me out today, and I'm going to show you the very first pose. So Angela, bring your elbows underneath your shoulders and coming into Sphinx pose, so lifting up. Now this is just such a great pose to do for a couple of reasons. One, it starts to gently, in a very kind of easy and simple way, start to put the curve back into the lumbar spine. So that's first and foremost. This is such a wonderful technique because when you come out of this pose, it's going to start pulling that disc material back into the vertebrae by creating kind of like this vacuum effect. This is a pose, by the way, that's recommended by a lot of doctors, especially orthopedic surgeons that specialize in vertebral issues in the body. Now, as you're doing this pose, just relax as much as possible. So really allow this area to sink into the table. Don't really worry so much about kind of correcting your posture in the upper body. The most important thing I want you to do is just to be here, be relaxed, and take some deep breathing. So if you're taking some deep breaths, send those breaths into the lumbar spine. And again, once in a while, I'll actually start to jiggle my glutes just to make sure that they're relaxed. If you feel like you have pain that's more on one side, a nice thing to do here is to take the elbows over to the opposite side that is hurting. So if you feel pain on the right side, Angela, just start to walk the elbows a little bit and kind of pivot your body, your upper torso. No, other way, to the left. No, to the left. So you come over like this. There you go. Not that much, just a little bit. And so you can start to feel this side sort of opening up a little bit. And one thing that's kind of nice is see if you can actually extend the left leg back, sorry, the right leg back a little bit more. Take it back a little. There you go. And then once you kind of feel that opening, just relax into it. And again, take a few deep breaths. Now, when I'm doing this pose on myself, which I often do, because I'm actually dealing with bulging discs, and this is one of the few poses that really brings me a lot of relief, I will stay in this pose for 5 minutes. I always set my alarm for 5 minutes, so I know that I've done the complete 5 minutes, and it always works. It always helps me avoid issues. Okay, so Angela, come back to center and we're going to show them the second pose. So come on down, bring your head down and bring your hands underneath your shoulders, and then just bring the hands just a little bit wider. Now this is a pose called Cobra pose. In yoga we call it Bhujangasana. And what you're going to do is just press up as much as you can. Keep the pelvic bones down, so let the pelvic bones down. Drop the shoulders back and lift up the chest as much as you can. Draw the chin down a little bit, extend through the back of the neck, and then exhale, come on back down. And we're just going to do that a few times, and you can do this at home as many times as you like. Just come on up, relax into the lumbar spine, lift up through the manubrium or the center of the chest, exhale, come on back down. And again, you're just kind of doing this up and down movement. It's really nice. Draw the shoulder blades down the back and exhale, come on down. And as you're doing this action, you're starting to create almost this pumping action in the lumbar spine, which is so good because the lumbar spine and the disc material inside the vertebrae doesn't get a lot of blood flow to it. So when we're doing this practice, relax the pelvic bones down. When we're doing this practice, we actually start to pull or draw more nutrients into the disc material. Again, very hard area to access, but this kind of movement starts to create more blood flow, bringing more nutrients and more blood inside the disc material, and thus starting to regenerate it, hopefully a little bit. At the very least, you're starting to allow for more space to happen inside the vertebrae. A lot of the discs start to pop out because the vertebrae are starting to press down on each other. So we want to create that space as much as possible. Anytime we start doing any kind of extension practices, like Bhujangasana, we start to open up the opportunity for our discs to, again, open up, start to align. And we also are exercising the muscles of our back, which is also really important. Let's do it one more time, Angela, but stay here. Draw the shoulder blades down. Keep the elbows bent, guys, as you're doing this just a little bit. Let the pelvic bones drop, but lift up at the heart center. Lower the chin just a little bit and exhale, come on down and relax. Take a couple of breaths. And again, I hope you guys start to include this little routine into your daily practice because it will really help to start to correct some of those bulging discs that might be happening in your lower back. Once you start to correct that, the pain in your back and the pain shooting down your legs will go away, and then you'll be a happier person. And isn't that what it's all about? Happy practicing, guys. Namaste.